Dr. Claire Wolfe, and I was president of the AAEM from 1998 to 1999. My biggest accomplishment is surviving my year as presidency and enjoying my year as past president, which is probably what most people on this tape will say. Amongst my accomplishments, I can't think of anything except I probably didn't offend too many people, which is fairly surprising for me. And I was president in between Dr. Dorfman and Dr. Busis, which was fairly significant study in contrasts. I was the first, I'm still alive. I am the first woman president of the AAEM, and therefore probably, and hopefully not the last, because of course Dr. Wirch is president this year, and Dr. Nora is in the line to become president. So that was probably a pretty good accomplishment. The other thing I like to think I accomplished was shortening our board meetings from 2 very long days down to 1 moderate day. But that was a major accomplishment of getting work done. And my fondest memory, probably as both president and board member for several years, was going to finance committee meetings in Rochester, Minnesota in February. I think that will be my fondest memory and nightmare. Thank you. Let's see, I think I'm also supposed to talk about what it was like to practice medicine when I was president, but it was only 3 years ago and times haven't changed that much. So let me tell you that I took my name badge off for this taping, but my name badge points out this year that I've been a member of this association for 30 years, although it's kind of you to say that I don't look like I've been a member for 30 years, but I have been a member for 30 years. And so I would tell you that since I went into practice and been a member of the AAEE and now the AAEM, is that times have really changed. The intrusion of managed care, the inability to do everything you'd like to do for a patient without getting approval, or certainly, for sure, not getting payment, has been a major concern, not only for our specialties in the AAEM, but probably for everybody in medicine. I think I had one other thought that just went through my senile brain as we were talking about this on accomplishments, because I think you will see it in the years to come, is that it was during my term that we started to look into how we should broaden the AAEM's outreach to other physicians, other specialties, how we would enhance our clinical focus away from just doing EMG and other electrodiagnostic studies into the clinical practice of medicine. And I think that was a major boost.